Scene.
My name is Rah Cortez. I'll be your RT this evening. Let me just check my physician's orders real quick. Let's see, what's the hullabaloo? Alright, it says I have to do an Ez-Pap on said patient. Before I verify if this is the correct patient, I will do my hygiene, wash my hands. Substitute soap and water for hand sanitizer. If it was soap and water, it'd be 20 seconds of washing and then 10 seconds of rinsing off. Okay, I'm down my PPE. Yes, it's the correct patient. Matches with my physician's orders. Okay. Ez-Pap is a positive airway pressure and lung expansion therapy, which means it's this right here. This is my equipment, my oxygen tubing, manometer, and I'm gonna use my flow meter here as well. Okay. Essentially, it is for the purpose of blowing air into his lungs, and his job is to blow outward. Okay. What it does, it helps with air trapping. It helps with delivering bronchodilation because it has a port to administer aerosolized medication. It works with cystic fibrosis. Helps with breaking down secretions in the lungs. Okay, and it helps with air trapping as well. Contraindications are it also helps with atelectasis. Also contraindication is also atelectasis. It also helps with cystic fibrosis. Contraindications are pneumo that has been treated. Active hematosis, rupture of the tympanic membrane, chronic bronchitis, and intracranial pressure of greater than 20 mmHg, and facial surgery, either cranial, skull. Let's just say, if he got it from this whole region, from his mouth to his head to his skull, got with some surgery or had some trauma, this ain't ideal. All right, nausea, that's a no-no. If he can't follow orders and commands in order to do this procedure, that's also a no-no. If he's mentally not there, he ain't mentally here to do this. All right, point blank. All right, if he's not able to tolerate it, that's another thing entirely. And if he's hemodynamically unstable, that's a no-no. All right. Hazards are tingling of the digits of your phalanges, hyperventilating, and barrel trauma, and dizziness. Those are all hazards, okay? He needs to reach a pressure of between 5 to 8 mmHg, okay? I'm gonna assemble my equipment, okay? This right here is where the marker would go, so you could assemble where in between he needs to be at. So if he needs to be between 5 to 8, I'm gonna put it in between 5 to 10. Okay, and this is the mouthpiece right here. I'm going to tell the patient to not occlude it with his tongue into the mouthpiece, because if not, then we're not going nowhere. He's not helping himself, and he's not helping me help him. get my oxygen tubing here situated. Connected to my flow meter. And this only works at a hospital because you need a gas source of oxygen. Because if you can't do this at home. This is not a home treatment. This is a home hospital treatment. Kind of like your incentive spirometry, instead of doing inhalation, you're doing exhalation. And make sure that it works. It's working. Just want to make sure that it works. So again, when you do the flow meter, you should put it ballpark between 5 to 15. Okay. Typically, the treatment is done 10 to 20 minutes, 4 to 8 times. Okay. Typically, what I would do is I'd have the patient before I do anything. Typically, I would have the patient in a semi-Fowler's position. But before that, I'm going. Give me 1 second. So assess my patient's pre-vitals. Okay. Oopala. Okay, typically what it would be respiratory rate, BP, oxygen saturation, and lung sounds. Alright, I'm gonna auscultate my patient now. I like to take 2 deep breaths every time. Okay, that's how you work it. Alright, now.
Make like an Excel sheet or a table on Google Docs.
2.
But before you do that, I would do like maybe
1, 2.
the practice scenarios that we just
1, 2.
something. I would do that. And also do the
2. Okay. 1, 2. I have diminished breath sounds of the lower lobes and audible of the apices bilaterally. Flavor. Alright, now that I know my pre-vitals, I'm gonna set it up real quick.
I already got. Did I send you the final?
You saw nothing. Okay, let me. I got a new mouthpiece. Here it is. The assembly. Okay, like I said. Oh, and I'll place the patient in a semi-Fowler's position, which is typically 45 degrees, approximately. Alright, so he's in the semi-Fowler's position. Okay. Placing the flow meter of oxygen at 5, and we'll go from there. I'm gonna ask the patient to place the mouthpiece in, don't include it. Okay, we're gonna take some breaths, right? But he's gonna go against the pressure that's coming in from here. Typically what would happen is this marker right here would go up and or down depending on my patient's capabilities or tolerance to the air pressure. Okay? Last for a few minutes. I'll wait a little bit. Once the patient is done,
Perfects in a row, bro.
That's good.
I'm gonna take the patient out.
That's gotta be a record.
Close that treatment.
That's
Thank you.
how I felt when I was
I'll leave it right here for the time being.
when I was studying for spirometry. For spirometry, I ended up getting.
I'm gonna proceed with his vitals after said treatment. But he needs to do afterwards. He needs to do his huff
That's another thing. We have
breaths,
to,
huff cuffs,
on Monday.
3 to 5 huff cuffs.
One that was
That's what is, as is what is instructed on 2 to 3, or or 3 to 5, one or the other. But typically it's 3 to 5 to 3 to 2, or 2 to 3. Anyway, he does it. It helps with expelling the secretions after said treatment of Ez-Pap. But now I'm gonna also take. Breathe in for me, okay? 1, 2.
I got 38, I was like, what?
1, 2.
Oh, shit.
1, 2.
The only year that they died on?
1, 2. 1, 2.
The average for that was.
We're still having some diminished breath sounds, and it's all still audible in the apices, but it's I hear slight improvements. So we're gonna do the treatment again.
Just come back to my old habits.
Anywho, the correct way as it should have been, but he did it beautifully anyway. He's the G. My patient is the GOAT. But he didn't do so well the first time, but I'm expecting greater results the second time. All right, same thing, okay? Just breathe in and out for me for a little bit. Have some regulated deep breaths before we administer the treatment. About 10 to 20 before proceeding.
Tomorrow, class isn't over yet. I haven't made up my mind.
This moment. Okay, patient is ready. Again, don't include the mouthpiece with your tongue. Have a firm seal on the mouthpiece. And because he didn't do so well last time, I'm gonna place the flow at let's say 7 liters per minute. Okay, so now he's fighting up against the pressure coming from the Ez-Pap. He has to exhale against it to help expand his lungs. It's work of breathing. Because this is all about clearing up all this mucus that's in there. Clear it up, make it work better, make him have a total lung compliance greater. But he's not doing it with total lung compliance. He's doing it with what he's capable of. Okay, because we don't want him to pass out here. All right. Patient will manage to hit the ballpark range between the 5 to 8, which is great news for me. I can at least see that he's managing to hit it, because the last time he didn't get to hit it. All right, I'm gonna cease treatment for now and proceed with his post vitals after he does his huff cough 2 to 3 to 3 to 5. All right, so that it helps those pesky secretions. All right, let me just turn the flow meter on for a second. Okay, now I'm going to
Sometimes I don't have time.
auscultate a patient,
I don't like doing it either, man.
you know, and get my post vitals.
I woke up from my nap.
Again, respiratory rate, BP,
Just know that, like,
pulse oximetry, and heart rate, and as well as lung sounds. All right, and you can breathe, okay? Whenever you're ready.
I just checked it.
1, 2. 1, 2. 1, 2. 1, 2.
word for word. I'm like, you guys are not even trying.
1, 2.
I ended up grabbing one of them.
Beautiful. I hear major improvement. Clear bilateral on both sides of his lungs. He is perfect. Afterwards, he's gonna do relaxing of 10 to 20 breaths and monitor his vitals, just to make sure that everything is all groovy. Okay. But otherwise, he is much better. Alright. Now I would ask the patient, is there anything that you may need? Do you want me to get the nurse for you? Do you want some figgy pudding? No? Okay, like I said, I just monitored the vitals and made sure that everything was right.
least you didn't include, hey, please rewrite the following paragraph in your submission. Like, what? What is this?
What was it? After that.
We have 2 semesters left, and then the last semester is just us to propose.
It's also every week we have to take an exam. And that counts in.
I guess that'll be over. I got the evidence.
Those exams are hard.
I guess that's all I would say.
And it was this week.
You don't want anything, need anything.
Presumably, I don't know if she's here though.
And then obviously I would then chart everything that I've just done with my pre-vitals, what was it? My pre-vitals, treatment, vitals during,
The only thing I didn't.
vitals after.
The idea of body weight. I completely forgot about it.
Oh.
And
It was only like 5 points.
my post vitals.
I didn't bring my.
I see that the treatment has major improvements. And then I'll throw in my gloves, and then wash my hands and say sayonara. Alright.
Done?
And the chart, I already said charting. Yeah, I did charting right now. Yeah, I said charting. Yeah, you're done.